Bernie Sanders was asked a question at a campaign event about Pete Buttigieg's Medicare for All. I'm sorry, Medicare for All, who want it. That's Pete's idea. And Bernard proceeded to break it down.
Could you please talk about why the message Medicare for all who want it isn't going to work?
It's not going to work for two reasons. Number one, and most importantly, it leaves in place a healthcare system designed to make huge profits for the insurance companies and the drug companies. It doesn't touch that. And we ultimately can never have a cost-effective healthcare system when the drug companies and the insurance companies are making huge profits and determining the priorities of our healthcare system. The insurance companies and the drug companies are not particularly interested in disease prevention. They got other goals as well. They're not particularly interested in making sure we have hospitals and doctors in rural areas. They don't make enough money doing that. So the only way we are going to provide health care for all is finally do what presidents have been talking about for well over 100 years. Think about what Teddy Roosevelt said, what FDR said, what Harry Truman said, what JFK said, what Lyndon Johnson said, what Obama said. Health care has got to be available to all of our people. And you cannot do that in an affordable way unless you have the courage to finally take on the drug companies and the insurance companies. Second of all, if you go with that route, what you'll end up with a two-tier Medicare system. The healthy and the wealthy will go into private insurance. The poor and the sick will go into Medicare, and that will be a disaster for Medicare in terms of the costs. What we need is one system which guarantees health care to all of our people, and the only way we do that is, in my view, through Medicare for all.
Anytime we have an open and honest debate about this, the left is not going to lose. Because for a long time, the propaganda was able to keep this idea under wraps. But now the propaganda is falling flat. It's not convincing enough. Because fundamentally, people realize this is just a discussion about priorities. That's all it is. That's it. So you have corporatists in both parties who say, no, my priority is to spend $7 trillion on the war in Iraq. My priority is to spend $2 trillion on the war in Afghanistan. By the way, both of those wars lied into and lied throughout. We were lied across the board. Corporatists say $14 trillion on a bailout, that's what I prioritize. A big bank bailout to the tune of $14 trillion. Well, as long as the people are educated on these terrible decisions that the politicians are making, they're going to look at it and be like, what are you doing? We're wasting all of our money on that. We could just take that money and we could pay for healthcare for everybody. Did you guys know, we've brought this fact up before, I think it was The Intercept who originally pointed this out, and credit to them for it. But in 2017, the military budget had at least an $80 billion increase from the previous year. Stop and think about that. And a lot of Democrats voted for it too. So they scream about how Donald Trump's a wannabe dictator and he's a Manchurian candidate who's Putin's puppet. And then they give him $80 billion more, an increase in the military budget from the previous year. Again, it's not that $80 billion is the entire military budget. No, it was like $780 billion, an $80 billion increase from the year before. You know what it would cost for free college for the entire country? $60 billion. You could have free college with $20 billion left over. And again, not a single person said, how are you going to pay for that military budget? How are you going to pay for it? How are we going to pay for it? How are we going to pay for it? How are we going to pay for it? Nobody said it. Nobody said it. Elizabeth Warren voted for that military budget. Elizabeth Warren. But anytime anybody ever brings up free college or Medicare for all, immediately, how are you going to pay for it? How are you going to pay for it? How are you going to pay for it? Here's the real question, guys. How are you going to pay for our current healthcare system? Because according to a study from the University of Massachusetts Amherst, a very detailed study on Medicare for all, it would save us $5 trillion over a 10-year period. $5 trillion over a 10-year period. Why? Because you're eliminating the unnecessary for-profit middleman. Of course you're going to save money. So funny enough, one of the main reasons Bernie brings up there as to why we got to go Medicare for all and not Medicare for all who want it is because the price is because Medicare for all is a massively efficient system. So ironically enough, some of the main attacks against Medicare for all just flip the reality on its head and they get it exactly wrong. And the reason they're giving is actually a reason to support Medicare for all, not a reason to oppose it. So whenever they're like, oh, the price. It costs less. It costs less. Now that's where they go, yeah, you're going to raise taxes on the middle class, but what are they not telling you? They're not telling you that Medicare for all eliminates premiums, copays, and deductibles. And they're also not telling you that premiums, copays, and deductibles are a private tax. You have to pay it, so it's a tax. It's just a tax to a private corporation. What they're saying is eliminate all the private taxes, raise the public taxes, but you'll still save money. If you're paying $10,000 in private taxes, you'll pay $8,000 in public taxes. So even though we're raising public taxes, you're still saving money. Guys, this isn't like, it's like trying to explain the most simple concepts. And, you know, when people actually understand it, they go, oh, they have the light bulb moment, but they've been lied to for so long, repeatedly, over and over, incessantly, and the media refuses to talk about this in an honest way. Every single debate, all of the difficult questions are to the candidates who support Medicare for all. They never, ever, ever ask a question to a candidate who doesn't support Medicare for all and say, well, hold on, 30 to 45,000 Americans die every year because they don't have health care. The only way you cover them all, free at the point of service, is Medicare for all. How many are you comfortable with dying every year under your system? There are 500,000 medical bankruptcies. The only way you eliminate that is Medicare for all. How many are you comfortable with going bankrupt over medical bills? They never ask these questions because, again, they have a bias. The media has a bias as well. So he also points out there that any proposal from any of the candidates that keeps the for-profit health insurance companies in control and hands them, you know, the structure of the system, says you're in the driver's seat. That's a terrible system. And it also sets up a two-tier system, which we do not want. We want every single person to have that gold plan that Congress has. That's the idea. And if you disagree with that, okay, ask yourself, who are you comfortable giving a bronze plan to? I'm not comfortable giving anybody a bronze plan. You want to know why? The bronze plans suck. They suck. Nobody deserves that. Everybody deserves everything covered free at the point of service. So, guys, this isn't hard what we're talking about here. We're talking about very basic stuff. And that's why a lot of these candidates like Mayor Pete are so frustrating. Because they're simply put, they're gaslighters. I think he knows that he's full of it. He does. But he's going to be more of a status quo manager than a real change candidate. And this is Bernie doing a great job pointing that out.